The field of adjuvant chemotherapy is moving in younger patients, but certainly also in older patients. And we start having trial information on elderly specific regimens. So the first trial investigating adjuvant chemotherapy in older people was an American CALGB trial that tried to prove that soft chemotherapy with capecitabine was equal to standard chemotherapy with AC or CMF. But that trial unfortunately showed that the soft chemo arm with capecitabine was clearly inferior to standard chemotherapy. Adjuvant setting, early breast cancer, older people above 65 years of age. So that's one important study, that you should give standard regimens to older people. A second regimen that is often used in older people is the TC regimen with docetaxel cyclophosphamide. It's based on the Jones study that proved that 4 times TC is superior to 4 times AC chemotherapy. And I think this is the reason, and it's quite well tolerated, and this is the reason why the TC is quite often used in older people, in contrast to younger patients where still anthracycline taxane regimens are standard. In younger patients, we still use anthracycline followed by taxane. But in older patients, this has more toxicity. Certainly the cardiac toxicity of anthracyclines is a concern. And that's why we are happy that we have anthracycline-free regimens like the TC regimen that is quite often used in older people. The TC regimen is a good regimen. There are other options. There are 2 very recent publications on paclitaxel monotherapy and docetaxel monotherapy, but those trials were not so positive. So I think we should rather stick to the combination of docetaxel and cyclophosphamide, which is the TC regimen. The less toxic regimens in general have proven to be inferior to the standard, except for the TC regimen that had good efficacy and acceptable tolerability. You should use regimens that have been studied in clinical trials, and you should not reduce doses of standard regimens by yourself. And in my opinion and experience, the TC regimen is a good regimen for older patients with proven efficacy and toxicity data. At this moment, no real room for very soft chemotherapy regimens in adjuvant setting for early breast cancer. HER2 positive is different because we need to add trastuzumab into the regimen. And in general, we still use the classical anthracycline taxane regimen with addition of trastuzumab. But for older people, this can be quite toxic. So we are looking strongly for better regimens with trastuzumab and soft chemotherapy. And there is one recent study looking at paclitaxel alone with trastuzumab. And it had very few relapses after 3 years follow-up, and it was very well tolerated. Now, this was not studied specifically in the elderly. It was studied in low-risk patients with tumors below 3 centimeters and without lymph node involvement. But I think this regimen is very attractive for older patients, also with higher risk tumors, although we don't have any phase 3 data or randomized data. We are all waiting for running adjuvant studies with new anti-HER2 drugs like pertuzumab and T-DM1, but we don't have any results at this point in time. We are now trying to construct adjuvant studies with these new anti-HER2 agents within the EORTC together with Etienne Brun from France, and we hope that we will be able to set up elderly specific trials with these new anti-HER2 agents. The EORTC Elderly Task Force is a clinical trial platform where we try to establish clinical trials and evidence for new patterns of care for older cancer patients. And for instance, we are now running a trial in metastatic HER2-positive breast cancer where we use new anti-HER2 treatments like pertuzumab and trastuzumab without classical chemotherapy. And if they progress, they can receive TDM1, which is another very promising anti-HER2 agent. So we hope that we can treat these older metastatic HER2-positive patients without classical chemo for a very long time. Absolutely. We know already from other settings that these new anti-HER2 drugs have a very favorable toxicity profile, and we are now evaluating whether they maintain tumor control for a long time. And the older people might eventually die from other causes and not from the cancer with these gentle therapies. In HER2-positive metastatic breast cancer for older people, we are currently investigating the role of new anti-HER2 agents, and we strongly advise patients to participate to these studies so we have the knowledge as fast as possible.